Good morning, everyone. Welcome to the webinar today for the Health Professions Pathways Program. We're delighted to be able to introduce this program to you today. My name is Karen Reisel. I'm Deputy Director here at Healthcare Workforce Development at Department of Healthcare Access and Information, or HCI. I have a team of people with me today to present at the webinar, and we'll be introducing them throughout the course of the webinar. Just to FYI to everyone, is we are recording this webinar right now so that we can make that available afterwards, and the slides are on our website currently for the presentation today. So our agenda today is what you see on the screen is that we intend to provide an overview of this new program and really talk and have an opportunity for you to ask questions as we talk about what goes into applying for this program, how we evaluate the program and reporting requirements for the program. So we'll jump right into the presentation today. So I just wanted to spend a minute talking a little bit about HCI as Department of Healthcare Access and Information. As you see here, that really the vision is that every Californian should have access to equitable, affordable, quality healthcare provided in a safe environment by a diverse workforce. And that is what this program is intended to do, is to create access to care by a diverse workforce. For those of you that are new to HCI, HCI was transitioned from formerly the Department of Office of Statewide Health Planning and Development, that transitioned to become HCI in October of last year as a result of the budget in last fiscal year. That process was set in motion, which really recognized our organization's growing responsibilities and expanding portfolio, and especially around health workforce, and understanding is how can we develop and build the workforce that we need both today and tomorrow. So on to the next slide. So this particular program that we'll be talking about today, the Health Professions Pathways Program, is part of our overall suite of programs under what we call the Health Professions Careers Opportunity Program, or HPCOP umbrella or suite of programs. The HPCOP program is in its entirety, it was guided by statute. A statute was established to really support the things that we see here on the slide. Cultural and linguistic diversity. How do we build the workforce that represents the Californians that it serves? How do we ensure that we're distributing the workforce adequately across the state? We know that there's areas where that are more underserved than others. So how do we build the workforce that serves and mitigate some of those underserved areas? And then how do we just increase the number of underrepresented individuals in the health careers in supporting them in health professions training and practice? And so with this statute, we are developing a kind of a portfolio of programs, a suite of programs. One of them is, as in our ongoing program, was the Health Careers Exploration Program. And that is a program that's intended to support career exploration opportunities for students and youth in a short time frame. And we just wrapped up the application cycle for that program, and we offer that annually. And then the second program that we're introducing as part of HPCOP is what we're excited to share today, is what we're calling our Health Professions Pathways Program. And it has it is robust and has several sub kind of activities within that we want to kind of dig into and share, but that's intended to really build that pathway, that long-term pathway with mentoring and support. And so I will turn the presentation over to Nancy Samra, a health program specialist in healthcare workforce development at HCI. Thank you, Nancy.
Thank you, Karen. So the purpose of our Health Professions Pathways program is to support and encourage underrepresented and disadvantaged individuals to pursue health careers to develop a more culturally and linguistically competent workforce. Underrepresented is defined as someone from a racial or ethnic group considered inadequately represented in a specific profession relative to the representation in the general population. And disadvantaged background is an individual from an economically or educationally disadvantaged background. The goals of our program are to support organizations developing and implementing career pathways, to inspire and prepare students for careers in health professions through training, mentorship, educational or financial support, and other means, to create and strengthen educational partnerships, community support, and workforce preparation efforts between entities. Partnerships could include high schools, higher education, health professions training programs, community health centers, public health departments, public behavioral health settings, geriatric providers, and community-based initiatives that promote health equity. And the last goal of our new program is to provide culturally and linguistically responsive programming, which requires recognizing and addressing behaviors, values, practices, attitudes, and beliefs. The eligible health professions include primary care, behavioral health, geriatrics, nursing, oral health, and allied health. Programs can list more specific information about professions they propose to promote within the application. There are 3 award categories, which include pipeline, summer internships, and post-undergraduate fellowships. Next, I'll review eligibility for each award category. HCI will accept proposals from eligible organizations. Individuals or other organization types are not eligible to apply. Universities and colleges and health professions training programs can apply for all 3 award categories. A health professions training program is defined as a program offering specialized healthcare training that will lead to work in a healthcare setting. This includes professional schools such as nursing, medical, dental, allied health schools, and graduate education programs, including residency, fellowship, social work, etc. We recognize that there is overlap between health professions training programs and higher education institutions. High schools or school districts serving high school students can apply for summer internships. And community-based organizations and community health centers can apply for summer internships and post-undergraduate fellowships. And community-based organization is defined as a public or private nonprofit that is representative of a community and provides services to the local community. A community health center is defined as community-based and patient-directed organization that delivers comprehensive, culturally competent, high-quality primary healthcare services. Health centers deliver care to the nation's most vulnerable individuals and families. These are also known as community clinics or federally qualified health centers. Next slide, please. Okay, so award category A, pipeline programs. As a reminder, eligible organizations for this category include universities, colleges, and health professions training programs. And the potential award amount is up to $500,000 a year. The program must provide comprehensive academic enrichment, career development, mentorship, and advising to support students from underrepresented communities and disadvantaged backgrounds to pursue health careers. Activities should lead to either entering a health profession school or beginning employment in a health career. And the program should touch at least 240 students a year. Award category B, summer internships. As a reminder, eligible organizations for this category include universities, colleges, health professions training programs, community-based organizations, community health centers, and high schools or school districts serving high school students. And this will fund paid summer internships for high school or college students in community health centers, public health departments, public behavioral health settings, geriatric settings, and community-based initiatives that promote health equity. And the maximum funding available at $5,000 for an internship and 20 internships a year. And our final award category is post-undergraduate fellowships, and our eligible organizations include universities, colleges, health professions training programs, community-based organizations, and community health centers. And this will fund 1-year post-undergraduate fellowships for underrepresented students in medicine for in-depth pre-graduate school experience in primary care and prevention, behavioral health, and geriatric health, and other health careers. The maximum funding available at $25,000 per fellow is for 5 fellowships a year. And that concludes my overview of the grant program. We'll now open it up for questions.
My name is Sharice Frisch, Executive Assistant at Healthcare Workforce Development at HCI. The chat option is disabled due to the volume of attendees, so participants may raise their hand icon for questions. You will find the hand icon at the top of your screen with the reactions button. Once you raise the hand icon, you will be placed in a queue. I will call on you by your first and last name. Your mic will be enabled and you'll need to unmute yourselves. To unmute yourself, the mic button is at the top of the screen. If we are unable to get to your question, please feel free to email the address on the questions slide and we will respond after the webinar. And we have Terry. If you would like to unmute yourself.
Hi, thank you for the presentation. I just had a quick question with regard to the 200 plus students that are eligible. If that number is below, would you still accept an application?
So within the application, we have structured space for programs to let us know how many participants they intend to serve. So I would encourage you to submit the application with that information so that HCI can evaluate all of the applications we receive.
Okay. Thank you, Nancy.
Thanks.
Thank you. And we have Liz Cochran.
Hi, everyone. Thank you again for the presentation. I have a quick question about eligible organizations. Would a nonprofit that runs summer internships for undergraduates be best eligible or a best fit under category B or category C?
We would be happy to follow up with you offline with any specifics. So if you could please send us an email to the HipCop mailbox, we can work with you through your eligibility question.
Sure, thank you.
Thanks.
Hi, this is Chris Hemerick. I just got mic access. I think it's my turn. I had some general questions trying to understand the types of things that would be funded in category A. So my question is, has this mechanism existed before, or there might be examples I could look for? And if not, can you give just some broad examples of the kinds of programs or interventions you might be looking to fund?
Sure. So for that category A pipeline program, there could be many different activities included. So I'll just provide some examples. So it could include financial aid dissemination, student health clubs, peer counseling, MCAT and other test preparation, Saturday academies, conferences, newsletters. There really is a broad variety of activities that it could include. So we are seeking for organizations to tell us about their programs and what they are proposing.
I noticed in that first bullet point under category A, it has things listed such as what you just mentioned, academic enrichment, career development. And are you looking for a strategy that might address all of those things in a very broad way? Or would a more specific strategy, maybe only focused at academic enrichment, be something you would be looking to fund?
So for this first cycle of funding, we would really like to see people's proposals to us, and so we can learn more about the pipeline and career pathways programs that are out there. So if you would like to send us an email, we can follow up more specifically offline.
Great. And then I think that comment indicates that this is the first time you funded this exact type of mechanism.
Yeah, this is a brand new program, so this is our first funding cycle.
Is it modeled after anything federally or other states have done?
So there is a federal health career opportunity program as well. I think they call it the National HCOP Academies.
Mm-hmm.
And then there are throughout the state different career pathways programs that are in existence.
Great. I really appreciate the information. Thank you so much.
Thank you.
Thank you, Chris. And next we have Dorothy Breton.
Hi,
Dorothy.
Dorothy.
Dorothy?
Yes, I didn't know if you were able to hear me.
Oh, yes, thank you.
Okay, sorry, my mic thing was faded out, so I couldn't hit it. Thank you. This is a great presentation. I was wondering, for the post-grad programs, is there more than one award for each program? Would be qualify for more than one $25,000 fellow award? How does that work?
Yeah, so for that category, programs can apply for up to 5 fellowships a year. So 5 fellowships.
Okay, so that's per program. Okay.
Yeah.
Up to 5. And is it restricted to a 1-year post-grad fellowship? We have a 2-year, so it would just cover the 1 year.
That's a great question. Can I ask you to send us an email and we
You
can
bet.
you? Thanks so much.
Okay. Thank you.
Thank you, Dorothy. Next, we have Lisa Lopez. If you'd like to unmute yourself. Lisa? Lisa, go ahead. Okay, we'll come back to you, Lisa. Next we have Robert Neeson.
Hello, thanks for the presentation. Can you hear me?
Yes.
Great, okay. So I'm wondering, can a single institution, it sounds like you'd be submitting a single application that would, say, for example, cover both a proposal for category A and also for category B. Is that accurate? Like a single application would, okay. And then within that application, would it be appropriate, would it be acceptable for us to say target different student populations, like category A going after, promoting pursuit of primary care at an undergraduate institution? And then say, for example, for category B, could we say, for example, propose helping students that are interested in public health, for example, do internships in a public health department? So would it be possible for part A and part B to be very independently moving pieces?
Yeah,
Okay.
absolutely. I think so. I would just ask that you know, make sure that we have that information in your executive summary and some of the qualitative questions in the application so that we can evaluate the proposal.
Okay, I was thinking in contrast of like a truly pipeline program where all the pieces connect, where the same student group, say, passes from the category A component into the category B component.
Right. So for this first funding cycle, we are going broad with what we do. So that may change in future funding cycles, but for this cycle, that proposal sounds perfectly appropriate.
All right, thank you.
Thank you, Robert. And next we have Gulate Samita. Gulate, if you'd like to unmute yourself. Gulate.
Okay, sorry, apologies, sorry. Thank you. My name is Sumedha Gulati. I wanted to find out about the possibility of partnerships. Is the program open to like a lead applicant with partners? And then the second question, just if you could go into a little bit more detail on how the budget structure, budget proposal requirements a little bit more. I know it was stated there, obviously for each of them, how much would be allocated per year. And then also like up to 15% for indirect costs. So just a little bit more detail on the budget and the possibility of a lead applicant plus partners.
Sure. So our next presenter is actually going to review the budget detail. So I'll ask you to hold a few minutes for that part of your question.
Okay.
And then as far as partnerships, yes, the Health Professions Pathways program absolutely encourages partnerships. And we do want to learn about the partners that you have within your application. There is space for you to tell us about that. And as far as your question about a lead agency, could I ask you to send us an email about that so I can make sure we're giving you all the appropriate information?
Okay, sure. And then I just had one quick request. Would it be possible to get the application as a PDF? I know right now it's on a portal, just so we can look at the whole application.
Yes, actually, I thought that we had a PDF version of it posted online, so we will look for that link and drop it in the chat.
Okay, thank you.
Thanks.
Thank you, Gulate. We have time for one more question, and Lisa Lopez, if you would like to go ahead.
Hi, can you hear me?
Hi,
Yes.
Lisa.
Hi, I have a couple questions. Can you confirm how many years of funding you can request?
Sure. So this is a 5-year grant, and our next presenter, John Madriz, will go over more of that information as well.
Perfect. My other question is, you mentioned the different categories of funding. Do you have any idea, any sense of how many awards you're going to make in each category?
Since this is our first cycle of funding, I don't have any way to predict that.
And there's no preference per se. You plan on awarding, you plan on making awards in each category. You just don't know how many, correct?
Correct.
Okay, thank you.
Thanks.
Thank you, Lisa.
Okay, well, thank you, everyone. And I will now pass it over to John Madriz, who is the Grants Management Chief at Healthcare Workforce Development.
Thank you, Nancy. Good morning, everyone. My name is John Madriz. I'm with the Grants Management over at Healthcare Workforce Development. And thank you for attending this webinar. I'm going to start by going over the application itself and the funding elements regarding funding and awards. So we have about $16 million in available funds for career pathway programs. The grant period is for 5 years. So it goes from fiscal year 22-23 to fiscal year 26-27. HCI may award full, partial, or no funding to an applicant depending on application evaluation results, geographic coverage across California, and the amount of the available funds. So as was mentioned earlier, we cannot predict the number of awards that will be given. This is a competitive application process. We'll be looking to see how everyone scores, and we're also going to be looking and ensuring that there's as much geographic coverage across California. When we review the applications, we will then make a decision as to how much to fund each applicant and the number of applicants that are awarded under each category. Next slide, please. Grantees may not use the HCI funds to supplant funds that the grantee has received from another source for the same purpose. The whole idea behind this is to invest this money to expand existing programs or to develop new programs. It's not to replace existing funds. Next slide. Okay, on our website, we have a link directly to the online application, but you can also, on this webinar, there's a direct link. It's an actual online application. We just recently posted a PDF version of the application so you can review the questions in advance before filling out the application online. We also have the grant guide that's available on our website, and we highly encourage everyone to review the grant guide fully before starting the online application. Most questions can be answered just by reviewing the grant guide completely, and we highly encourage you to do that. You can seek to support more than one award category, so you can apply with one single application. You can apply for category A, B, and C, depending on if you meet the eligibility requirements. So you can apply for multiple categories with one single application. Next slide, please. On your application, when you go online, one of the things you'll be asked to do is to list your current and proposed program sites. You're also going to be asked to identify the specific health professions that your proposal will promote. You're also going to be asked to provide with a summary overview of the major program components, your activities, services that will be provided, and the geographic area that's going to be served. You'll also be asked to identify any major partners for your program, and you'll be asked to describe how your program will monitor and evaluate the effectiveness of the program over the course of the 5-year period. You'll also be asked to describe your organization's experience in exposing underrepresented individuals to primary care, geriatric care, behavioral health, and/or any other health careers. Next slide, please. Indirect expenses may not exceed more than 15% of the total dollars requested. Applicants will submit a 5-year budget, as I mentioned before, from fiscal year 22-23 all the way through fiscal year 26-27. And new program applicants, you may budget for a planning year. So if you're a new program, the first year, 22-23, could be your planning year, and then you can have active participants the following year. However, for existing pathway programs, we expect all the programs to begin implementing and expanding your programs during this coming fiscal year 22-23. Next slide, please. Okay, does anyone have any questions?
So yeah, again, this is Sharice Frisch, Executive Assistant at Healthcare Workforce Development at HCI. And the chat option is disabled due to the volume of attendees, and participants may raise their hand icon for questions. You'll find the hand icon up at the top of your screen with the reactions button. Once you raise your hand icon, you will be placed in a queue. I will call on you by your first and last name. Your mic will be enabled, and you will need to unmute yourselves. To unmute yourself, the mic button is at the top of the screen. If you are unable to get to your question, please feel free to email the address on the question slide, and we will respond after the webinar. Okay, I see Jessica Pitt has a question. if you'd like to go ahead.
Hi. Yes, I actually have 3 questions. Is the summer internship program that's only for summer internships? If we have a program that runs internships all year long, could that funding be used beyond the summer? That's my first question. I'm also curious about the 5-year time span for the summer internship program. So if it's $5,000 per intern and up to 20 interns, the budget could be $100,000 over per year for 5 years. So I'm love some clarity on that. And then if we're an internship program that is funded with grant money, so soft money, would that qualify? Would that fit under your expand existing programs or add new programs if it actually is an ongoing program? We just don't have permanent funding stream. Thank you.
So first off, for the program itself, it is intended to be a summer internship program. There may be some flexibility, but the goal is to cover the summer months. We can look over your proposal. It's not intended to be a year-round program, but it's intended to cover summer internships. So, but we can look over that question and just let us know what period of time will your program cover. Is it a 5-month program, a 3-month program, 2-month program? We'll evaluate the application itself based on the information that you provide us. And regarding the budgeting, the program the program itself is intended to cover the full 5-year period. And so for summer internships, you can have 20 internships per academic year. So, so you can have that over, that's 20 internships every year over a 5-year period, which could be potentially 100 participants in internships programs over a 5-year period. For the fellowship program, that's the one that's 5 fellowships per academic year, and could have as many as 20 participants over 25 participants over a 5-year period. In both cases, if this is a new program, then the first year could be spent in just developing the program, but the subsequent 4 years could be spent in having the program up and running and started. But for existing programs, we expect the programs to have up to that number of participants per year.
Thank you. Next, we have Sarah Pugach.
Sarah Pugach from UCLA Extension. Just a clarifying question about the availability of funding. Am I understanding correctly that the $16 million of available funding will cover the 5 years of programming, or is it there's $16 million available annually as we will be structuring our budgets annually? I just want to make sure I understand correctly.
Yes, the $60 million covers any grant awards over the 5-year period. So when we start making the awards, the grant amount, the $60 million covers the entire 5-year period of those particular awards that we make. Every year we intend to open up a new cycle, but for this current cycle, we have $16 million available to fully fund the programs over the 5-year period.
Great, thank you so much for that.
You're welcome.
Thank you, Sarah. And we have Lisa Lopez next.
Hi, thank you for posting the PDF of the application online. Is there any, before we get into it, are there any character limits or word counts for any of these responses?
I believe there are some limits. I'm not familiar with the amount, the actual character limit, but
I can take that, John.
Okay, thank you.
Hi, sorry. This is Dorian Rodriguez. So for some of the qualitative questions like the executive summary and things like that, it is 1,000 character limit.
Okay, thank you so much.
Thank you, Dorian.
You're welcome.
Thank you. Next we have Lisa Lopez.
I already went, thank you.
Excuse me. Teresa Cofield, if you'd like to present. Teresa, are you available to present your question? If you'd like to unmute yourself. Okay, I hear you. Teresa, are you available for your question?
Joyla?
Pardon me?
Thank you for that. I hope you can hear me now.
Oh, yes.
Yeah, I just wanted to ask a follow-up question. Thank you for providing the PDF of the application. If there needed to be any attachments submitted, further describing our program proposal. I did not see anything so far in the quick review.
We're trying to ensure that we consistently receive the information from all applicants. So we're not entertaining any attachments. I mean, you can email us information about your program, but for reviewing the application itself, we're not accepting any attachments or any reports. We're going to score the applications based on the information that's provided to us, both in the quantitative questions and the qualitative questions, where you can fill in and summarize your program. Our goal is to review each application independently. So we do not have, the application itself is not allowing, we're not allowing for folks to upload additional attachments, because we want to make sure that we fairly score each applicant based on the information that's provided and available on our online application.
Thank you.
You're welcome.
Next, we have Dorothy Bratton. If you would like to present your question, go ahead.
Hi, thank you. And I'm with Shasta Community Health Center in Redding, California, by the way. My question, I was just looking at the eligibility quiz, you know, if we were eligible, and it says, asks if we're accredited. We're in the process of being accredited for our postgraduate training program. Would this be something then that would have to wait until we were fully accredited?
We don't have the specific accreditation requirements on this application. We will look to see if you're applying for any special accreditations. If you wish to share that information to us, we would appreciate it. But for these specific programs, you know, this is our first cycle, and we will be looking at the strength of the applications. If you do have any special accreditations for your training programs, we encourage you to provide that to us. And but for this round, for these particular programs, you know, we have accreditation requirements for other programs, you know, such as residency grant programs and other programs that we have. But for this one, if you do have accreditation or you're planning to be accredited, I would encourage you to inform us of that. So that way, when we look over your application, we'll have a better understanding of the strength of your program.
Thank you. Lisa Lopez, if you'd like to.
Hi, sorry for more questions. Hopefully this is the last one. In the application, in the PDF version, I see the signature line at the very end, and you want the applicant to certify. Do you expect that signature? Do you expect this application to be filled out by the program director or where the university? So is this expected to be our grants and contracts office? I'm just kind of curious who you expect to fill out this application.
Well, in most cases, it's either the program director or the person who's authorized to apply on behalf of the organization. So whoever has that authorization can fill it out. Because eventually we'll have grant agreements. They'll need to be executed at a future point when we make the awards. But for the application itself, we just need to make sure that it's someone who's authorized to speak on behalf of the organization.
Perfect. Thank you so much.
You're welcome.
Thank you, Lisa. And we have time for one more question on Teresa Cofield, if you'd like.
Yes, I had a question regarding the number of participants in category A. It had 240 participants, and I wanted to know for programs that are existing and trying to scale up their programs, if that is 250 different students per year. We do use a cohort model and would like to see students moving through our programs year by year, or is it actually over the 5 years of the grant, there would be 240 participants times 5?
My understanding is the intent was to have, separate individuals per year. However, we do not have specific requirements that indicates that it has to be separate participants over the 5-year period. We will look at the applicants that are submitted to us. Our goal is to try to support as many individuals as possible. We just set that as a minimum amount for the funding that's available, and so we do not have any specific requirements in our grant application or grant guide that they be separate individuals over the course of 5 years.
Thank you.
You're welcome.
Thank you, Teresa. That concludes the questions for this section.
Okay. Well, thank you so much. I appreciate your time. I'm now going to move this on to Dorian Rodriguez. She is our research data specialist over at Healthcare Workforce Development.
Thank you, John. So I am going to talk a little bit about the evaluation criteria. I'm basically just going to go over some of the themes. You will be able to see the specific questions and criteria, as well as the maximum number of points you can earn. You can find all of that in the grant guide that is available online, and I believe there's a link in this PowerPoint as well to that. So for the first criterion is looking at whether your program sites are located in health professional shortage areas. And you can also receive additional points if your program takes place in a rural or frontier area. For the next criterion is looking at cultural and linguistic diversity, basically how your program is planning on being culturally and linguistically responsive to program participants. Next, you will be looking at whether your program will promote one of the priority health professions, meaning primary care, behavioral health, or geriatric care. The next criterion will focus on how your program will address challenges specific to the target program participants. And then we will also be looking at whether you have experience exposing economically and or environmentally disadvantaged individuals or individuals from health professional shortage areas to health careers. And then whether you support individuals from certain underserved groups. And those are all, again, listed in the evaluation criteria in the grant guide. And then finally, looking at how many years of experience your organization has exposing underrepresented individuals to health careers. And then next, I am going to talk a little bit about the annual program reports that are required from the grantees. So you will be required to report on student outcomes, including some of this following information. The reporting will include, but is not limited to, information about the program and details about program implementation, as well as evaluation and data collection, which will include summary data on participants, attending events, as well as summary data of pre and post surveys and workshop presentations and highlights. Category A, B, and C recipients must conduct participant post surveys. And again, there are some specific survey questions that are listed in the grant guide to kind of give you a heads up of what those questions will be. And then in the annual activities report, they must also provide data on some demographic information, educational background, employer information, and student status of all participants. And grantees must also identify how the grant funds were expended. And then finally, category A recipients only, in addition to all of those other things, must also provide in the annual activities report data for each group of students. So some of these data include information such as the number of students that attended recruitment events, the number of students accepted into the program, number of students that received peer mentorship, et cetera. And again, all that information you can find in the grant guide. And thank you. That is all I have. So I think it is question time now. Thanks.
Thank you, Dorian. My name is Sharice Frisch, and Executive Assistant at Healthcare Workforce Development at HCI. Chat option has been disabled due to the volume of attendees. Participants may raise the hand icon for questions. You will find the hand icon at the top of your screen with the reactions button. Once you raise your hand icon, you will be placed in a queue. I will call on you by your first and last name. Your mic will be enabled and you will need to unmute yourselves. To unmute yourself, excuse me, the mic button is at the top of the screen. If we are unable to get to your question, please feel free to email the address on the question slide and we will respond after the webinar. So we have Deborah Jones, if you'd like to go ahead. Deborah Jones, would you like to present your question? Unmute yourself. Okay, we can come back to you. We have Chris Hemrick, if you'd like to.
There, can you hear me now? This is Deborah
Hi,
Jones.
Deborah, yes.
Oh, sorry about that. It wasn't letting me unmute. Can programs be offered online and serve students in these priority areas, or are you looking at on-site, actually physically on-site programs in these areas?
So I believe the intention was for the site to be in these areas. I don't think we actually addressed online participation, but it would be the physical location of where your program site is taking place.
Great, thank you.
Chris Hemrick, if you'd like to go ahead.
Sure, thank you for taking my question. I wonder if you would go back to the slide that's titled Grant Application Evaluation Criteria. And maybe a little bit similar to the last participant question, I'm curious if you're thinking about these evaluation criteria as related to the participants in the program, for example, at the location of the school, or if the students, let's say, are going to go out into the community and do an experience, if you would be thinking about the people receiving those services. I'm not sure my question is clear.
Yeah, I got it.
Okay.
So no, these are targeted specifically to the program site location. So say your program site is at a university in a health professional shortage area, regardless of where your students are going, it still is just focusing on where that program is located.
Got it. Thanks for
That makes sense.
clarifying. And
Sure.
I appreciate understanding my poorly worded question. And then
No worries.
similarly for the other items, not about the area, but like cultural and linguistic diversity, for example, would you be looking at the cultural and linguistic diversity and support for the participants or for the community they'll be serving?
The question is specific to program participants. So it would be kind of things like how you're being responsive to the participants, right? So it's also looking at whether or not you've hired staff members who are bilingual, or hiring staff members to promote equity and things like that. So, so it does kind of cover how you're responsive to the participants, but also how you are doing those things. Does that make sense?
Absolutely. Thank you so much for clarifying. That's really helpful.
You're welcome.
Thank you, Chris. Anyone else have questions? Please, we welcome additional questions if anybody has. Okay, Chris Hemrick, go ahead.
Well, I guess I'll just keep asking questions. Maybe the ones people are thinking about. I know this is a new program and I'm really excited about that. In the data reporting and evaluation criteria, I wonder if you've thought about any kind of shared evaluation tools that all programs would report on, or if you would like us each to propose our own.
So I believe that there will be some type of instrument or something that HCI will develop. So in terms of, you're required to report on student outcomes using some of these things, HCI will be developing instruments in order to collect those data from you. Does that answer your question?
Yeah, it does. I'm thinking about your role as a data scientist and the chaos would ensue if each program kind of reported in their own way.
Absolutely. Yes, that's why we'd like to make it more structured, so that it all comes in the same way. And yeah, so we will take care of that.
Great. Thank you so much, and good luck developing your tool. This is building the plane while it flies, which is super exciting.
Yes, thanks.
Thank you, Chris. And we have time for a couple more questions. Any questions you might have, please, we welcome. Okay, Bob Arnold, if you'd like to go ahead. Bob, if you'd like to unmute yourself.
Bob, if you're having technical difficulties, remember there's always the option to email your question and we can provide you an answer after the webinar.
Okay, any other questions? We can come back to you, Bob, if you're able to unmute yourself. Any questions at all? We welcome anybody has. Okay. Oh, here we go. We have Gulati Samida. Go ahead.
Just a quick one. Apologies if it was addressed before. Is there a word limit in the application? The qualitative parts?
Yes.
And or are we able to do attachments?
Okay, so there are no attachments currently allowed for like uploading anything in addition to the application. As far as the word limits go, for the qualitative questions, you'll see like a large text essay box within the application. And those are maximum of 1,000 characters. And it does keep a word count as you're typing in the application. So you'll be able to tell like, oh, I'm getting too close now. Only have like, 5 words, then I'm able to go. So it keeps track for you. Does that answer your questions?
Yes, thank you.
You're welcome.
Thank you, Kalati. We have time for one more question. Anybody has any question? And Bob Arnold, if you are able to speak, go ahead with your question. If you just unmute yourself, okay. Any other questions? Okay. If you think of something later, yeah, please feel free to email the address on the screen, hpcop@hcai.ca.gov.
Oh, looks like we have another question. Lisa,
Just
go ahead.
last question. Where can I download these slides?
I believe they are available on our website.
Okay,
Do we have a link in this slide deck? Yeah, okay. Yeah, they're on the website.
Perfect, thank you.
You're welcome.
Thank you,
All right,
Lisa.
thank you, everyone. I appreciate all the great questions. I am now going to hand things back over to our Deputy Director, Karen, for some closing comments.
Great. Thank you, Doreen, and everyone else. Thank you so much for everybody that attended and for the really thoughtful and questions. We look forward to following up with any of you afterwards. Just wanted to provide a little bit of a summary that we did open this application on May 31st and it closes on June 30th. And so the website that is listed here has all of the information that you need. It has the grant guide, it has the application, and with all of the information and for how to contact us. We one of the things that we will be working on is putting together an apply button on our website so that you can go directly there. The actual application right now is embedded in our grant guide, but we're putting together a way to just apply directly. But we encourage you to read the grant guide and take a look at that. We also, and it sounds like some of you had already taken a look at our funding eligibility tool, just to be aware of the little survey that we have that people can enter to see what programs you may be eligible for, whether it's this one or others that individuals or organizations may be eligible for that HCI operates. And so I think that is it for our conversation today. The slides are on the website and we are recording, which we'll be posting that. We also encourage you, if you're not already, to subscribe to our mailing list. We do a monthly update of all of our workforce programs, and you can go to our this address here on our HCI website and subscribe to a mailing list to receive regular updates about all of our programs. Again, thank you. Oh, and so the apply here button is on the website, so take a look at that. But we thank you very much for your time today, your interest in this program, and we look forward to receiving applications. Thank you so much. That concludes our webinar.